Before seeking autism diagnosis for yourself or your child or teen, it's useful to have an idea of whether you or they are likely to be autistic. One of the quickest ways to do that is to take the Autism Spectrum Quotient test. There's a childhood autism spectrum test and an adult autism spectrum quotient test. One is for testing yourself, the other for completing in relation to a child. The results of the test will give you a strong indicator whether you or they are likely to be autistic or not. To be diagnosed autistic, there are certain traits that they'll have to have. How these traits express from person to person will be unique to each individual. Sometimes, at first glance or first thinking about it, you may not recognise yourself or your child as having one or more of the traits, because in others they may be masking or covering up that they have that difficulty, and they or you may behave in a way which makes you think the difficulty isn't there. An example of this could be that you are outgoing and confident and the life and soul of social situations as you see it. So you feel that you don't have difficulty with social communication or social interactions, yet when you explore further you may discover that you are the same around anyone, meaning that at times perhaps your attitude is socially inappropriate and you don't notice perhaps when people are uncomfortable with your behaviour or with your jokes, that your behaviour is very one-sided. Perhaps you do all of the talking about what you want to talk about. You don't really do any listening or engaging with others, and you don't seek out comfort or closeness to others. To be diagnosed autistic, the traits have to have been there in the person's whole life, as autism is a developmental disorder. So it's something you're born with. Usually you need to be able to evidence or state why a diagnosis is important. It can't usually be just to find out if you're autistic. It has to be demonstrated that in some way these traits limit or impair everyday functioning, so that the person will be struggling in some way. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published in 2013, notes that autism spectrum disorder is characterised by A. persistent deficits in social communication and social interactions across multiple contexts, as manifest by the following, currently or by history. Deficits in social emotional reciprocity, ranging, for example, from abnormal social approach and failure of normal back and forth conversation, to reduced sharing of interests, emotions or affect, to failure to initiate or respond to social interactions. Deficits in non-verbal communicative behaviours used for social interaction, ranging, for example, from poorly integrated verbal and non-verbal communication to abnormalities in eye contact and body language, or deficits in understanding and using gestures to a total lack of facial expression and non-verbal communication. Deficits in developing, maintaining and understanding relationships, ranging, for example, from difficulties adjusting behaviour to suit various social contexts, to difficulties in sharing imaginative play or in making friends, to absence of interest in peers. B. Restricted repetitive patterns of behaviour, interests or activities, as manifest by at least 2 of the following, currently or by history. Stereotyped or repetitive motor movements, use of objects or speech, e.g. simple motor stereotypes, lining up toys or flipping objects, echolalia, idiosyncratic phrases, insistence on sameness, inflexible adherence to routines or ritualized patterns of verbal or non-verbal behaviour, e.g. extreme distress of small changes, difficulties with transitions, rigid thinking patterns, greeting rituals, need to take same route or eat the same food every day. Highly restricted, fixated interests that are abnormal in intensity or focus. For example, strong attachment to or preoccupation with unusual objects, excessively circumscribed or pervasive interests, hyper or hypoactivity to sensory input, or unusual interests in sensory aspects of the environment. For example, apparent indifference to pain or temperature, or an adverse response to specific sounds or textures, excessive smelling or touching of objects, visual fascination with lights or movement. Symptoms must be present in the early development period, but may not become fully manifest until social demands exceed limited capacities, or may be masked by learned strategies in later life. D. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. And E. These disturbances are not better explained by intellectual disability, for example intellectual development disorder, or global developmental delay. Intellectual disability and autism spectrum disorder frequently co-occur to make comorbid diagnosis of autism spectrum disorder and intellectual disability. Social communication should be below that expected for general developmental level. Along with these areas, the autistic person could have above, below, or average intelligence. They could have other additional conditions like epilepsy, obsessive compulsive disorder, anxiety, depression, attention deficit hyperactivity disorder. Some people may be more internally focused and perhaps quieter. Others may be louder and more externally focused. This can lead to some being overlooked because they don't appear to display any problems, as they're just quiet. Some may appear very childish for their age in the way that they behave. Others may appear very grown up. When seeking a diagnosis for yourself, your child or teen, there are some important things to remember. It isn't just a case of going to the GP and asking them to make a referral and to have an assessment. You'll need to say what behaviours you or your child does and what traits they have that make you think that they may be autistic. You'll have to say why it is that you want the diagnosis. It's common in most places that they don't diagnose just because someone is autistic. Rather, they only diagnose if the person is being affected by being autistic, and where a diagnosis would be helpful. So if the person's needs can be met and behaviour can be managed without the need for a diagnosis, then this is usually preferable to labelling someone. There are many people on the autistic spectrum without diagnosis who cope relatively fine and who don't need a diagnosis to get the additional support that they may require. You'll also have to demonstrate how the person's behaviour and traits happen in all areas of life, for example home, community, and at work or school. And you have to describe how the behaviour and traits have been observable pretty much since birth. You want actual examples given, so describing incidents to back up what you're saying. It's useful to get these things written down, and in case you give that copy to a GP or an autism assessor, it's handy to also make sure that you've got a photocopy or a copy of that. All of this information needs to be on the letter that the GP sends to the Child and Adolescent Mental Health Service or the Child Development Centre or the Adult Autism Assessment Team, depending on who is doing the assessment. If the team receives a letter from a GP just saying that this person would like to have their child assessed for autism spectrum disorder without any supporting information, they'll likely just reject that letter without ever meeting the child or ever meeting yourself if the letter just went to, say, the adult assessment team with no covering information. Likewise, if there's only evidence of difficulties in one area of life, for example family home for children and perhaps school is fine or vice versa, then they're likely to reject the referral. With adults it could be that you never go out, so you don't have issues outside the home. Or maybe you do a job that's structured to suit you, The assessment will usually consist of some detailed questionnaires to fill out. These will often be some multiple choice questionnaires and some free-form questionnaires. Sometimes it can be helpful to have support in filling these out, and if you need support and you don't know anyone who can give you that support, you can ask when you receive the paperwork, and they'll recommend how to get the support that you require. Sometimes the assessment team may have a phone consultation with the parent or the person, which may conclude as either positive, a diagnosis and being classed as autistic, or negative, a conclusion that the information given, that it doesn't sound like the person is autistic. Prior to the last couple of years, I don't really know of many places that do frequent assessments via the phone. There can be very long wait times. So wait times in my area have improved, but it's still about 8 to 12 months for adults or children, whereas it used to be about 4 years wait for children to get assessed in my area. If it's an assessment in relation to a child or a teenager, then the assessors will usually ask if it's okay for them to talk to other involved professionals. So they'll talk to the school, they'll talk to social services if needed, or antisocial behaviour team, whatever other organisations may well be involved or have information on that child's life, as a way of trying to gather extra information. For adults, it's common for them to want to speak to your parent or someone like a doctor, ideally someone who's known you your whole life, who can talk about what you were like when you were a very young child, younger than you're likely to be able to remember and talk about yourself. So those very early few years of life. And if there isn't someone around who can do that, perhaps you're a much older adult, then they will try and look at alternative ways of gathering that information and trying to make a judgment. But it makes it just a little bit harder for the assessment team when they can't gather that very early years information to see and check whether you've always been the way that you're presenting now. And seeking a diagnosis can be a long process. Sometimes parents can feel that they're being treated as though they're bad parents. What's often suggested is to have parenting support even before diagnosis, not because the parent is being seen as a bad parent, but because there are things that they may not know or be doing which could potentially improve home life. And these things will work with most children, both on and off the autism spectrum. But when someone's on the autism spectrum, it is even more important that those things are done with consistency. When I used to work in parenting support, the first thing that CAMS would often do was to give the parents my details and tell them to use my service. Parents contacting me were often frustrated, saying they didn't want parenting support. What they wanted was to find out if their child was autistic. In reality, the only thing that is different is tailoring the way that the parent applies the various concepts that I would be helping them with. It was never about them being a good or a bad parent. It was just that it could be a long wait for a diagnosis, and if they're struggling and having challenges, it's best to start creating change now and putting things in place now to support that child. There are some things which can make someone grow up with the same kind of behaviours and traits as autistic people, like growing up in abusive households or in neglectful households. So assessors will often want to rule those things out before going forward and saying here's an autism diagnosis. They want to make sure that the various traits that are being displayed aren't because of growing up in a neglectful or abusive household. It can obviously be helpful to take in some notes for yourself. So when you fill in the forms before going for diagnosis, you may want to take some notes on your answers to expand on things, because especially with like the multiple choice questions, you may have opinions on them where actually not everything applies exactly as was written, and so you may have said I don't have a problem in a certain area, but there may be caveats to that, like reasons why you don't have a certain problem. And so you may want to just go in taking some notes so that you can explain that when they're going through all the questions they ask you in the assessment. It's quite common that at the end of the assessment, the face-to-face assessment, or if it was done over the phone or via Zoom or something, at the end of that assessment that you'll be told whether it seems you're autistic or not, and or whether they think that your child is autistic or not. And so you'll know, usually you'll know right away, you'll know there and then this is the situation. But it could take a couple of weeks to a month or so, depending how long it takes them to write their reports up, for you to actually get that in writing, so that you can then maybe use that if you need it, for example, for accessing occupational health support in a workplace, or for yourself, or for a child where maybe you're trying to get them additional funding in school and they can access certain budgets in the school. If you can say, yes, my child is autistic, here's the evidence to prove that. And that could then perhaps get them a member of staff having a certain number of hours with that child. And obviously, following a diagnosis, there is no obligation to go around telling other people. It may be helpful. In my opinion, I found it very helpful to start telling other people, I'm autistic, just got my diagnosis, and being able to then have people opening up conversation and have people understanding me better, rather than just, he's rude, he doesn't do this, he doesn't do that, and having their judgments of me. They had some kind of framework that they could at least start understanding me through and engaging in conversation with me about it. So I could have that conversation about how, if there are things I say or do that upset you, I am autistic, and so I have a tendency to, for example, not recognise when maybe you're annoyed with me, or not recognise that I'm supposed to have behaved in a certain way with you, or a tendency to say something that comes across as rude, but it's not meant to be rude, it's just me just telling you something. And so I can then have those conversations and then tell people, just come and talk to me and just tell me if I've done something to upset you. It's never intended, I never mean to hurt anyone's feelings. I always try and do my best and be the best human that I can be. So just come and tell me and say, Dan, this upset me. Or Dan, so like when I was a manager, people would come and say, Dan, I'd like you to ask me if I'm okay more often. So I would never ask staff if they're okay. So I would then make a note for myself to remind myself, for example, whenever I see a member of staff come into the office, just ask them if they're okay. So it would open up that conversation for me to be able to learn and develop and improve myself, while also then improving how I am with other people. So that improves the sort of situation with them as well. So there are some issues I've got in relation to the way that autism diagnosis happens, and the main issue is that ordinarily you go for an autism assessment and you get told that you're autistic, or your child gets told they're autistic. You perhaps get told, go and find out more information on the National Autistic Society's website, and if you really want to, they offer a card so that you can then get the card that says you're autistic, and then show that if you want to, as a way of helping people realise you're autistic and understand it a little bit. And then they say goodbye, and you go. And it can be relatively similar with children and teenagers, that the assessment happens and you don't have any aftercare. So I work with a family where their child was diagnosed autistic, and I was called in because the parents were really struggling. But the main thing the parents were struggling with, when I asked them about what makes you feel like things are difficult at home, etc., was my child doesn't look at me when I'm talking to them, so they obviously aren't listening and don't care, and so I have to then shout at them to try and get their attention, and they still won't look at me. And they knew their child was autistic, the child was diagnosed autistic, but they hadn't learned anything about autism. No one had told them anything about autism. No one told them that someone can be listening and not making eye contact, and that not making eye contact doesn't mean they're not listening. And so I just had to give them a bit of understanding around autism, and things they saw as problems stopped being seen as problems, and there weren't really that many things that were actual problems. It was just this kind of conflict of how people should interact between how the autistic child is interacting with them versus how they thought that autistic child should be interacting with them. So I often feel that the diagnosis is just the start of the journey, not the end of the journey. It's the time when you now know, right, 100%, child or myself, whatever, we're autistic, and so now I know a place where I can start investigating and learning about myself, learning about the various traits, learning about the challenges I have, learning what skills and abilities I'm lacking, which other people have just instinctively gained through life experience because their brains are wired differently, and I can start trying to learn those as actual skills, as if I was learning a hobby or something. So it just gives you that kind of perspective on being able to do something about it, whether it's for yourself or you now know this about your child, and so you can now support your child through that growth and that exploration. So normally people seek diagnosis for a child because they think this child has problems in some way, this child is struggling in school, this child is behaving badly, whatever it happens to be. It's normally there are problems, and so we need to sort this out. Maybe they're autistic. They become diagnosed, and you get told at the assessment, yes, they're autistic. Autism is a neurodevelopmental condition. They were born autistic, and it's untreatable. They'll live their entire life autistic. So that's what the kind of message that a parent picks up at an autism assessment. And some parents hear that as, my child has these problems, I took them for a diagnosis, they've got the thing that's causing these problems, and I've just been told this thing that's causing these problems they've got for the rest of their life untreatable. And that can be disheartening and can make some parents really, really struggle and lose faith and lose hope in the potential for the future for their child. So during my parenting courses, I used to often flip that and talk about the positives of their child's traits. So maybe their child is very narrow focused at times, maybe their child notices patterns really well. Whatever the strengths are that I hear the parent talk about their child that are because the child's autistic, I would start just trying to direct the parent's focus on the strengths. For example, I think that the fact I'm autistic is what makes me a very effective therapist, because I don't get drawn in to the emotional content of things people tell me. I notice the patterns in what people tell me, and I also can go home and not take my work home with me in terms of like the emotional side. So I can hear someone tell me something really traumatic in a therapy session, and an hour later I can be sat eating a meal and not think about that negative thing at all. Whereas I know non-autistic colleagues who have ended up having to take time off work with depression and various other challenges because of the fact that they've heard all this negative stuff that's really built up and played on their mind, and they've not been able to let it go, and they've not been able to stop thinking about that abused child that they're trying to work with, or whatever it happens to be. And that child is constantly on their mind when they're at home having dinner with their family and all the rest of it. And it doesn't matter how much clinical supervision they're getting and what have you, they just can't let go, and they can't get that image out their mind of what that child's going through and what that child's told them, that they end up having to go off sick from work. So I put down a lot of my strengths and the praise I've been given by managers over the years for my ability as a family worker and as a psychological therapist down to the fact that I'm autistic, and so I just view things differently. So it causes me certain limitations, like my connection to others is lacking, and I find that harder. So when I have clinical supervisions, I'm working on trying to develop that rather than trying to detach from things. But it is because I'm autistic that helps me to be able to do things as well as I feel that I can do them.